Caitlin Smith, and today we're going to be doing a review of systems, and I'm going to be doing a physical assessment over a 49-year-old male patient by the name of Russell Cole. All of his vital signs are within normal limits. If any of the vital signs were abnormal, then I would do teaching, and I would also do further consultation. But his were all within normal limits, and you can find those within the typed portion of the assessment. Today, before I actually start the assessment, I'm going to do a review of history with him concerning the abdomen GI-GU systems. For him, all are within normal limits. Then we're going to go straight into the inspection. So the first thing that I'm going to do is I would ask my patient to lift their shirt up. And what I'm doing is, once the patient has lifted their shirt up, I'm looking for and inspecting the abdomen. I want to get down on eye level and look. Are there any bulges? Are there any pulsations? If there are any bulges, that could be indicative of something like a ventral hernia that might require surgery. If there are any pulsations, that might be something a little more serious, especially if he is complaining of abdominal pain, of a tearing or ripping, or if he's having any tearing or ripping pain in his back, that might be indicative of an aortic aneurysm. Our patient, he does not have any pulsations, and I do not see any bulges. Once we get down on eye level and inspect, we can move up to the abdomen. We're looking for any moles, any lesions, anything like that. Our patient does not have any moles, any lesions, any scars. If we do see any scars, then we may want to inquire where they received their scars from. It may be from previous surgeries that they forgot to tell us about, or from any previous injuries. So our patient has within normal limits as far as inspection goes of the abdomen. The next thing that we're going to do, we're going to move on to auscultation. And what we want to auscultate with the abdomen is we're going to auscultate all of the abdominal quadrants. There are 4 abdominal quadrants. So we're going to take out our stethoscope, and we will use the diaphragm of the stethoscope to begin the auscultation. And we want to auscultate. And we're listening. Do we hear any hyperactive? Is it normal active? Sluggish, slow? And you want to ensure that you listen to all of the quadrants until you hear bowel sounds. If you do not hear bowel sounds, then you want to make sure that you stay in that quadrant until you do. If you do not hear bowel sounds, then you want to make sure that you report that to the doctor or to the advanced practicing nurse. After you auscultate with the diaphragm, you want to move into auscultation with the bell. And what you're going to do is you're listening to the bell, or you're listening to the arteries with the bell of your stethoscope, and we're going to listen for any bruise. And you're going to listen over the aortic, the abdominal aortic. You're going to listen over the renal artery. You're going to listen over the iliac crest. And then you're also going to listen over the femoral too. Our patient does not have any bruise noted. Everything is within normal limits. Now that we have completed the auscultation, we are going to move on to the abdominal reflex. And how you do the abdominal reflex, what you're going to do is you take a tongue depressor, and we have nerve endings in our stomach. And part of this portion, what you're going to do is you're going to use a light sweeping motion of a tongue depressor, and you start at the navel of the patient, and you sweep away from the navel, and you should see as you sweep away from the navel that those nerve endings, the navel will actually jump in movement. Some people have a stronger reflex than others. It may be very slight, but you're going to go in a motion, and you're going to go down. Okay, and his reflexes are within normal limits. Let's see, after we check the reflexes, next we're going to move on to percussion, and I'm going to do an abdominal percussion with an indirect method. And you're listening, are there any abnormal tympanic sounds? We're listening for dullness, hyperresonance. Our patient has within desired limits. The last thing that we're going to do is we're going to palpate. And you always want to start out with a light palpation and then move into a deep palpation. So we're going to start on one side of the abdomen. I'm going to start with a light palpation, and you want to ask the patient while you are palpating, does any of this hurt? Is it tender? Are you having any pain?
No.
Okay. And then we can move into a deeper palpation. And our patient does not have any abnormal history reported concerning the liver or the gallbladder, but during the palpation stage, if they do have any history concerning the liver, this will be a time to palpate the liver. Also, you can check for a positive Murphy's sign on gallbladder. What you can do is you can ask the patient to take a deep breath in, and as they take a deep breath in, do they have any pain under their right upper quadrant? If they do, that might be a positive Murphy's sign, which would be indicative of gallbladder disease. Something else that we could do using our stethoscope and also the tongue depressor, we can actually measure the liver. And what you would do is you would take your stethoscope and you would place it in the region of the liver. You would need to palpate first. And what you're going to do is you would start at the bottom and you would listen. What you're going to do is you would listen with your stethoscope and you would make the scratching motion. And as you scratch up, you should be able to hear a change in sound. And as you hear that change in sound, the first sound at the bottom, you're going to mark with a pen mark or with a skin marker, and you continue scratching up. And then at the last point that you hear that sound, you will mark again, and then you can measure. A normal liver length would be 6 to 12 centimeters. Let's see. But like I said, our patient does not have any or does not report any abnormalities as far as liver. Let's see, I believe that this concludes the abdominal assessment. Thank you.